Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. J. Calvert, along with my very esteemed and exhausted co-host, Dr. Millicent Rovelo, by Zoom.
Good evening. How are you?
I'm good. I know that you have been working very hard, though. And I know that you have, like the other night when you said you had a 5 o'clock start time, I was like, that's so not cool, because you know you're not starting at 5 o'clock if it's a 5 o'clock start time.
Oh, no, I started at like 7 that night.
Yep. There you go.
Yeah.
So you've been working hard, which is great. I know that, there's no substitute for getting in a lot of good cases when you're, just love operating, which is good. But at some point, you got to take a minute
to do a podcast.
That's mostly what I need you to do. Yes. We have a great topic tonight. I actually thought this is something that comes up a lot, especially since you and I are doing many more facelifts. I think it's just because I'm getting older that that the facelifts are coming our direction now. But I know that you have a bunch booked, and so do I. And so one of the things that we need to talk about is the skin prep prior to a facelift, and then when you get back into your Medi-Spa treatments, lasers, Botox, fillers, because it is always a question like, well, when do I get back to the rock spa? When do I start doing that stuff again?
Right.
And it comes up a lot.
And I think that the two work very well together, and they serve a purpose when used in unison. You do have to time them correctly, though. So when you're talking about prepping the skin before a facelift, to me, what that typically means is doing some kind of preparation of the quality and tone and texture of the skin, getting it primed for a facelift, because you don't want to do this beautiful facelift where you make everything nice and tight and then the skin just looks like leather. It really takes away from the effect of the facelift.
Yeah, I don't prep every patient with lasers, but if they look like my sofa, then I tell them that we've got to do something about that before we get in there. Because typically when I see a patient for a facelift, face, brow, eyes, the whole deal. And that's the other thing. People always say, well, what is a facelift? I mean, the technical definition of a facelift is the lower face, the jawline, and the neck combined together. And really, facelift is a jawline kind of clarifying procedure. That's what it does. When you talk about the brow and the mid-face and eyelids and all that, that's sort of different, but some people lump that all together and call that a facelift.
Yeah.
So it's always important to be clear about the terminology that you're using. But regardless, the time that I will tell somebody to do some lasers is when their skin just looks like it is not going to move. It's leathery, it's sun damaged out the gazoo, and it looks like we're going to have a hard time making it look nice. Then I always do send them for a little bit of resurfacing, either 1 or 2 treatments. If we have, you need 4 or 5 months for that. You can't just do the lasers and then get in the operating room. It doesn't work that way.
Yeah, you need to give it some time to cool down. And it depends on the type of laser you're doing. If you're doing a CO2 laser, which is very effective with just 1, maybe 2 treatments, you only need 1 or 2 treatments. If you're doing a pixel laser or Morpheus or something that's a little bit less intense with the resurfacing, maybe you want to look at doing 2, 3, or 4, depending on the severity of the skin. And you can certainly do it afterwards as well. But I agree that getting the skin ready for the facelift is very important, because you want to have that big reveal moment where you take the bandages off, you wait a week or so, you see the swelling coming down, and you just look like this newer, more refreshed version of yourself. And that's a lot harder to do when you still have that old, dry, sun-damaged skin.
And it also depends where you practice. We practice in Southern California, so people get a lot of sun damage here. It's just part of the deal. Back in Pittsburgh, everybody's skin was like butter. And it's just, you could, it was, they just never saw the sun. There was only 64 sunny days a year on average in the Berg. And so those folks didn't really need to be preconditioned. They were already, basically they had like really soft skin that was not overly toasted. Our, golf crew and our